Alistair Burns is my name, and I'm the National Clinical Director for Dementia and Older People's Mental Health at NHS England and NHS Improvement, and Professor of Old Age Psychiatry at the University of Manchester. We know that the number of people living with dementia is increasing, and so we need to find ways to improve the way that people with dementia lead their lives, and very importantly, to support their carers. To help us, we need to know much more about how dementia changes over time and the impact that it has on people and their families. We know that people have different journeys through dementia, and we've published what we call the Wellbeing Pathway, which is preventing well, diagnosing well, treating well, living well, supporting well, and finally dying well. One of the things I was taught early on in my career is when you've met one person with dementia, you've met one person with dementia, and we know that each individual experience is different. Having said that, we know that there are things that can suggest when dementia is changing. Things can happen. Memory loss can suddenly increase, falls, changes to medication, or episodes of confusion. And if we can get information on this, we can better predict what's going to happen to people with dementia. And if we can do that, we can get in early to prevent crises. It's helpful both for planning an individual's care and supporting their family, but also when we're testing new treatments, whether they be drug treatments or whether they can be social interventions. And knowing the natural history is so important. And this is where primary care is key. We know that there's lots of information kept in primary care, and primary care are brilliant at looking after long-term conditions, which is what dementia is. Every time we visit our general practice, there's lots of information that is stored, and that's a real wealth of information that we can use to look at the natural history of dementia. And the study you're about to hear of is an example that just does that, and it has the real potential to transform the way we look after people with dementia, support their carers, and understand more about the disease.
Hello, I'm Kelvin Jordan, Professor of Biostatistics at Keele University and the Chief Investigator of the MEDIP study. The MEDIP study set out to identify potential markers of dementia-related health that are recorded in primary care electronic records and that may indicate progression of dementia. We identified potential markers by looking at past research studies, find markers previously suggested to indicate dementia progression, asking healthcare professionals, researchers, people with dementia and their carers what they thought these markers might be. Carrying out analysis of a large pseudonymized database of primary care records from over 30,000 patients with dementia. From this, we have derived a set of markers of dementia-related health that are frequently recorded in primary care. We found these markers appear to have validity as indicators of dementia progression. For example, having these markers is associated with longer-term outcomes, such as going into hospital, moving to palliative care, and dying earlier. We group these markers of dementia progression into 13 groups, and we call these domains. These domains include markers of cognitive function, such as memory loss or confusion, safety issues, such as a recorded fall or fracture, daily functioning, such as difficulty moving about, eating, or looking after oneself, increased levels of care or having an advanced directive in place, diet, such as poor nutrition or weight loss, change in medication related to dementia, severe neuropsychiatric issues, that is, severe mental illness, such as a psychosis or needing to be sectioned, other neuropsychiatric or mental health problems, such as depression, behaviour issues, or sleep problems, pressures at home, such as family problems or bereavement, new symptoms, such as dizziness, swallowing difficulties, or hearing loss, a new diagnosis, such as heart disease, diabetes, or asthma, needing to take more medications for different illnesses, and being sent for investigations, such as an X-ray or ultrasound.
Hello, I'm Carolyn Graham. I'm a general practitioner in Manchester and a researcher at Keele University. So how does the MEDIP research help my work as a GP? Firstly, some of the markers that have been identified are possibly things that we can help people change about their lifestyle. For example, supporting people to make changes in their diet, understanding more about the course of dementia and what factors affect the progression of dementia will help myself and my colleagues in general practice offer better management to people with dementia, but also to their carers. If we can identify individuals who've got a poorer prognosis, who are likely to do less well, we can plan treatment and make sure that appropriate treatment is available at the time when people with dementia and their carers need it. There may be also benefits for research. If the markers that we've identified allow us to track progression of dementia, this will help future research studies test the effectiveness of new treatments or new drugs without waiting for costly and intensive outcomes. At the moment, we rely on hospital admission, care home admission and mortality, and the MEDIP markers might be useful shorter term outcomes.
I'm Michelle Marshall. I'm a research fellow at Keele University and principal investigator of the MEDIP study. So how this research can help people with dementia and their carers. So this study is the first and important step that will eventually allow patients and their carers to have a better understanding about dementia and how it progresses, and better predict longer term outcomes in people with dementia. This will lead to there being better care and support in place for people with dementia and their carers, and it will help test new treatments for dementia. The next stage of our research is to assess if these markers can predict longer term outcomes in dementia, and we will discuss with healthcare professionals, people with dementia and their carers how these markers can help in consultations and in the management of people with dementia. The MEDIP study was funded by the Dunhill Medical Trust. For more information on this study, including information on the markers and the domains, please visit www.keele.ac.uk/MEDIP.